And when he is in Nagaland, we need to ask certain questions on behalf of the people of Nagaland, because you cannot have a one-way traffic. You cannot have the Home Minister talking about Jal Jeevan Mission, the roads, the development, the health sector, etc., etc. And that includes especially the Ayush Atalman Yojana. We have to ask questions on that, because at the end of this press briefing, I will share with you a video and you will see what has happened at a hospital close to you. So, when he has come here, I am going to refer to a report from 2021. You know very well that this government does not share data. And the data that it shares comes with great difficulty. So this 2021 ICMR, National Center for Disease Informatics and Research. This is chapter 7. And this is about Nagaland. And this exposes the health department of Nagaland. It is in shambles. And why is it in shambles? Because the double engine Sarkar has given a lot of information in this report. And in this report, it shows its I don't care attitude. How? Because it says that there are 397 SC, 56 HWC SCs, 126 PHCs, 05 HWC PHCs, 21 CHCs, 11 DHs. But what they are hiding are certain facts. They have also said there is one tertiary cancer center. The state is covered under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, ABPMJAY. But when you actually look closer into this report, my dear friends, the truth is revealed further. What is the truth? The truth is that there is no sub-district hospital under the tertiary healthcare facilities, and they have put this over there. There are 0 medical colleges, 0 state cancer institutes in a state where cancer is rising rapidly. And you know that there are lots of cancer patients. But we will come to that in just a minute. There is a 0 regional cancer care center and only 1 tertiary cancer care center. Now, the Ayushman Bharat Yojana merely says that the state is covered under it, but no data is given. And you know very well why. COVID-19 showed us how there was shortage of beds, there was shortage of oxygen, and how the health system had collapsed completely. And we have not learnt any lessons. That is the sorry state of affairs today. This is a double engine ki trouble engine Sarkar. And when you talk about data for Ujjwala Gas Yojana, this is the report that needs to be referred to. Because you know what they have said is, they have made it lucid that only 24.9% rural households have clean fuel for cooking. So you don't have clean fuel for cooking, you get unwell, there is no jal in the nulls, and there are no nulls for long distances. So when there is jal, the jal that people consume has iron, arsenic, and God knows what all contamination. That is also one of the reasons for the rising cancer patients in Nagaland. But nobody has an answer to that. However, let me also give you another data. 345 children between the age of 12 to 23 months have not received immunization with penta and hepatitis B vaccination. I beg your pardon, 34%. 34% children have not received immunization with penta and hepatitis B vaccination. But now I will come closer home. And closer home means better facilities. Where? In Dimapur, of course. But Dimapur District Hospital, which caters now to 3 districts, the districts of Chumukadima, district of Newland, and district of Dimapur. What has happened over there? We know parkats are rampant in the state. No matter who says what, when you need good health care, people from remote areas will also come to Dimapur. But first, their bones are going to get rattled while they are traveling right to Dimapur. After that, once they are here, there is no Jal Jeevan mission. But I am going to show you some visuals from 18th February 2023 of District Hospital, Dimapur. And what does it show? It shows power cut. The facade shows a power backup is present for the front portion of the hospital. When you enter, there are lights. And when you go to other parts of the hospital, there are no lights. Can you imagine that, my friends? I'm sure all of you living in Dimapur know this. But this is a question that needs answers from the state government of BJP and NDPP led by Mr. Rio. And it also requires an answer from the Home Minister Amit Shah, who is visiting Nagaland today. I have visuals where you will see in the hospital nurses treating patients in candlelight. Yes, my dear friends, candlelight. And of course, if these visuals are anything to go by, it just means that Mr. Amit Shah comes here for votes because, like the BJP likes to proclaim, they are 365 days, 24/7 in election mode. But they cannot give governance. They cannot give facilities. And this needs an answer. Why has Nagaland been left in such a state? Has nothing been learned from the COVID onslaught? Has Mr. Amit Shah, Mr. Narendra Modi, Mr. Neiphiu Rio, who talk big, but on the ground when there is nothing, do they have answers for the people of Nagaland? For the health sector, the people of Nagaland are waiting for answers. For the Jal Jeevan mission, the people of Nagaland need answers. And now let me show you what I've got for you, my dear friends. And this is alarming, because if in a state where you have a double engine sarkar and you do not have facilities, it just goes to show that the government does not care. Rio says, I don't care. Narendra Modi ji says, I don't care. And Amit Shah ji is saying today, I don't care about you. I will come and give a bhashan because I need your votes to stay in power. Here, my friends, take a look at these visuals now. Northeast is not Nagaland. Did he say anything about Nagaland? No, because he spoke about the Northeast. Maybe he's given facilities elsewhere. We don't know about that. But here in Nagaland, the financial capital of Nagaland, Dimapur, this is what you get to see. Nurses are working in candlelight. Can I go further? Take a look. These are nurses. Can you imagine? They are working so hard to save their patients. How they must be feeling when they have to go through this. And now I'll show you a video. Excuses, I would say. I mean, this is the district hospital. I mean, in Dimapur. If a government that is so powerful, which is in an opposition-less assembly, if it cannot save its battery backups, then who's responsible for it? Our people, people's lives are important. Supposing there was theft also and something had happened to some patient, who would be responsible? How do you know that this has not happened to other people? These are mere excuses. When you have a government, the government is supposed to give, jobs to people. And this is, if you look at it, it's got a larger context, because if people don't have jobs, that's why they're stealing, right? And people of Nagaland are definitely not the kind who would like to steal. I have left things here and there while I've been in Nagaland. And I've come from outside. I've never lost anything. I have actually left things in shops and gone back to those shops and got them back. I don't think we should insult people by saying this. People of Nagaland, should be respected. And if there is a fault, that fault lies with the supervision, with the administration. It is the responsibility of the government to look into these issues. I'll tell you this and share this with you, that Congress President Shri Mallikarjun Kharge ji will be addressing a public meeting tomorrow. And he will also be interacting with the media. So I would like to give you a little brief on that. He will be arriving at Dimapur Airport at about 12:30 hours tomorrow, 21st February 2023. He will address a public meeting at Difupar Village Council ground after that. And then the Congress President Shri Mallikarjun Kharge ji will interact with the media at Shunamite Inn at 2:30 p.m. And of course, he will be leaving from Dimapur Airport at 4 p.m. So I hope that all of you can be there, and there can be more people who can come and be part of that interaction, and before that, part of the gathering. Thank you so much.